Hello, everybody. My name is Brody Duncan. I am a physician and medical microbiologist in Hamilton at McMaster University. I'm also an assistant professor in the Department of Pathology and Molecular Medicine at McMaster. And today we're going to be doing the first lecture in our series that is medical microbiology for medical students. This series, the goal is really just to give you the very brief introduction to the huge diversity of organisms that we have in microbiology. This first series is going to be focused on intro to bacteriology. So we're really going to be mostly talking about bacteria. But I hope that as you go through, you'll see that these lectures are a useful introduction, but are not enough. So as you go and do more reading, learn more about clinical infectious diseases, and see patients, you can use these lectures as references if you ever need reminders about what different types of bacteria are, for example. So today, for this intro lecture, we're really just going to try and keep it simple. I want you guys to understand just how complex medical bacteriology can be. And we'll briefly talk about how Gram stains are useful for categorizing bacteria, which I'm sure most of you have already learned somewhat about the Gram stain. So medical microbiology as a field really focuses on four main areas of life: bacteriology, mycology, which is the study of fungi, virology, and then parasitology, which focuses on both microscopic and macroscopic eukaryotic parasites. So today we'll be talking about bacteriology because this is the area that in your sick hospitalized patients is the most common. And as a medical student just trying to learn about all this stuff for the first time, you really need to know about bacteria in order to just understand antibiotics. So the first thing that I really want to impress in your guys' minds that to me is so important is to understand that microbiology at its most fundamental is biology, right? In the medical world, it becomes so easy to just think about different bacteria as different types of diseases, the same way as we would for other organ systems. But at its heart, microbiology really is about the living organisms and their evolutionary relationships, both with themselves and in their interaction with human beings, right? So biology is one of those fields where it's so complicated because there's been billions of years of evolution. But as we learn more and more about science, we can try to put things in a bit of a schema to understand just how do all of these different organisms and infections fit in on the tree of life. So for me, as I was studying and learning about this, one thing I found really important about biology is to look for these evolutionary relationships to help keep your brain organized, right? Like imagine if you were an alien and you had to learn all about all the different animals that exist, right? Like it's a humongous task. But if you start to realize there's these patterns, like, oh, if I see this thing up in the sky and it has wings, then those are different types of birds. And if I see this thing in the ocean and it has these, flipper fins and it has this smooth body shape, then those are fish. These are tools that can help you categorize different types of organisms in your brain. And then when you're using them in a situation like a patient that has an actual infection in front of you, you can use that to try and pull specific concrete information out of your brain. However, I do also have to really impress on you guys that evolution is not a straight line, right? Like if you're this alien and you're using these schema to understand what different organisms are, all animals that fly in the sky and have wings are not necessarily birds, and all animals that swim and have fin-like flippers are also not fish, right? So these are tools to help you memorize, but unfortunately, they're not definitions, and you do just have to memorize the one-offs when they come up, which unfortunately is all the time. I will say, as a medical microbiologist, that as a learner, microbiology kind of sucks because there's so much memorization. So one tool that is particularly useful is the Gram stain. And the reason for this is because with the evolutionary relationships among bacteria, organisms that have a gram-positive result tend to be related to each other, and organisms that have a gram-negative result tend to be related to each other. These are not, hard and strict rules, but again, they're relatively useful the same way that wings and fins could potentially be useful if you were an alien, right? So just very briefly to explain what a gram stain is, for gram-positive bacteria, which is what we see on the left, they have a very thick cell wall made out of peptidoglycan. So if you stain it, it will stay purple. While for gram-negative bacteria, which are on the right of this image, they have a second membrane on the outside and then a thinner peptidoglycan. So then if we do the gram stain procedure, which on the right, you can see we start with unstained bacteria. We stain it with crystal violet, which is purple. We use a mordant, which kind of like bites in the crystal violet, which is iodine. And then we decolorize it using alcohol. You can see that the thick cell wall of gram-positives stays purple, while the thin cell wall of gram-negatives loses that purple color. And then we counterstain with safranin, which is kind of a red-pink color. And the gram-positives are already purple, so they just stay purple. And then the gram-negatives become this red-pink color to help us distinguish them. So that is the procedure for a gram stain. I don't know if you guys have to know the procedure. This is just to understand what we're doing. When you actually look at the microscope and you see, for example, on this slide, there are purple bacteria, and those are gram-positive, and there are these kind of red-pink bacteria, and those are gram-negative. You can also see that the gram stain is useful for actually looking at the bacteria under the microscope and seeing what shape they are. So another common thing that we use is describing the shape as either cocci, which is round circles, or bacilli, which are these more elongated rods. So if we look back at the image, we can very clearly see that the purple organisms are gram-positive, because P for purple and positive, and they are also definitely cocci. They are round. So we would call them gram-positive cocci. By contrast, the more red-pink organisms are gram-negative, because gram-negatives are this pink-red color. And they are definitely not nice little circles. They are these more rod-shaped organisms. So we would definitely call those gram-negative bacilli. So this is an incredibly useful tool. And one thing that's nice for us is that if we look at all the different medically important bacteria that we can grow in the laboratory and then put under a microscope, the gram stain is actually quite good at putting them into these different groups. So in my opinion, at the medical student level, and even as a professional medical microbiologist, it's so useful to be able to fit these different bacteria in your brain into these 4 categories of gram-positives and gram-negatives, which then split into GPCs and GPDs, gram-positive cocci and bacilli, and GNCs and GNBs, gram-negative cocci and gram-negative bacilli. Okay, so this is very important to try and fit every bacteria that will grow in a culture into these 4 categories. Now, as I was preparing these lectures, I was thinking, what about other microbiologic tests, right? Like you could have an organism growing on a plate, and then you can take it and do either simple little tests like catalase, or you could do complicated tests where you're using different biochemicals and seeing what all the different reactions and all the different agar are. And I had to learn all that because I'm a medical microbiologist as a profession. But on the right here is a picture of a fancy little machine, which is a multi-top mass spectrometer, which, to be honest, for a lot of bacteria, we just put it in this machine and then it spits out, oh, you've got E. coli, or oh, you've got Staph aureus. So these tests are not useless, but for medical students, I got to be honest, I don't think it is worth your time to study these things unless you're going to take some like weird exam in the future where you're forced to know this. In this lecture series, I'm really just going to try and focus on the microbiologic tests that are important and useful for you guys to know when you're categorizing bacteria that cause clinical infections. No one's ever going to say, oh, can you tell me the catalase reaction for Enterococcus? Because that's not clinically relevant, right? So with all of that information, I'll just give you a brief synopsis that here is our slide of needs to know typical bacteria, where I'm using the word typical to mean bacteria that will grow in cultures like blood cultures, urine cultures, wound cultures, surgical specimens, and that you will be encountering in your day-to-day on the wards. Although this seems like a lot, the good news that I'm going to try to tell you is that, in my opinion, this is kind of it in terms of typical bacteria. If there's things you need to focus on, it's these guys. We're going to go through every single one of them over the course of the next few lectures. And in my opinion, if you can categorize them into these relationships, like gram positives and gram negatives and cocci and bacilli, then it can make your life a lot easier when you're trying to pull this information out of your head, when you're trying to choose antibiotics for your patient that has appendicitis, for example. So I look forward to going through this entire slide with you over the next little while through a series of lectures, and I hope that you find this educational. Thank you again for joining me for this intro lecture. Here is my final slide just with some references for the open source pictures I used in this presentation, and see you next time.